Hello and welcome to today's presentation, Pet Services Infection Prevention Strategies Waging War on Germs. Today's webinar is being presented by Virox Animal Health, makers of Rescue and Prevail disinfectants formulated with accelerated hydrogen peroxide. There will be a live Q&A at the end of this presentation with Dr. Jason Stull, our presenter today, and a panel of experts. So please submit your questions at any time throughout the presentation by entering them into the chat section located on the right-hand side of your screen. So without any further ado, I would now like to introduce Dr. Jason Stull, Assistant Professor in Veterinary Medicine at the Atlantic Veterinary College and the Ohio State University. So over to you, Dr. Stull.
Well, thank you for the introduction. Such a pleasure to be able to speak to you all today. This is a topic that I am very passionate about, and I hope that if you're not passionate about it yet, that by the time that this webinar is over, that the time that we've had a chance to talk, you will be as passionate as I am about it. Something that affects all of us in every way, whether you bring your animals to a facility, whether you run a facility, whether you work at a facility. So first, just a few quick disclosures. So I am an assistant professor, as mentioned, at those two universities. I'm also a consultant and do have funding and consulting for a variety of businesses. And many thanks, of course, to Zoetis and Pet Air Therapy, as well as Virox, who have funded and brought this forward and allowing me to bring my information to you. Perhaps most important, I'm a dog owner, right? And as I'm sure many of you are, I take my pet to facilities when I travel, which unfortunately hasn't been very recently, but when I do, certainly is a place where I take my pet. And every time I take my animal to a facility, I am always obviously extremely careful about the facility I choose because this is a member of my home. And I want to make sure that Lila in this picture is afforded all of the benefits of a safe and enjoyable experience. And I'm sure that's what we all want for the pets that are in our facility. But at the same time, we are faced all the time, whether it's in your own facility, whether it's in another facility nearby you, with disease. And this is part of nature, of course, where, for instance, there's a couple of headlines here. So veterinarians warned of an unusual strain of kennel cough. So this was actually a different type of organism than they normally see with kennel cough. It's not necessarily a new strain. In the bottom, kennel cough leads to closure of a dog park, or owners are concerned about kennel cough. And these types of conditions are occurring again all the time. And what do we do as people who run these facilities to ensure that the animals in our facility can be safe and not have any concerns? So these are some of the things that your clients are concerned with, that are faced with. These are things, of course, that your staff are worried about. And so these are issues that we really need to be taking seriously. And unfortunately, there can be situations that are huge. And this is an example of when canine influenza virus, or canine flu, or dog flu hit the United States. This was in 2015. But many of you have either worked in a facility or in an area where they've had outbreaks of flu. I've heard about them. I've had the opportunity to talk to owners of facilities that have been crippled, and I really mean that, crippled by this organism. And in fact, there's a really nice quote at the bottom of this one particular slide. We describe it as feeling like we've been hit by the apocalypse. It was almost like every hour another dog started coughing, and then another and another. And as I think we all can relate to various components of infectious disease living with COVID-19 and how we are all working around this, I think we can appreciate, if you haven't personally seen this with dog flu, what it might be like, and obviously the concern in everyone that's involved. And there are things that we can do to make our facilities even safer and to protect ourselves against some of these things. So what does this mean for us? And so I hear this all too frequently, which is, yes, animals get infectious diseases, and that's unfortunate, but that's just part of life. And it's true, animals will get infectious diseases just like you and I. However, there are definitely some things that we can do to prevent or certainly reduce that occurrence. And why should we bother? Well, because yes, we may be talking about a few sick pets, but for those of you that have seen where this can go, and where this often goes, is it starts as a few sick pets. it then starts as, unfortunately, many sick animals. And so when I was speaking to some of these boarding facility owners, they would talk about they had the sick dog that started coughing, and then an hour later, again, exactly like that quote said, they had another and another. Within the day, all of the animals in the facility were coughing, some of them extremely ill in some circumstances. So we have many sick pets. We may have severe disease in some, and maybe even death, which is obviously what we certainly don't want this. Some of these diseases can also not only affect dogs, cats, but also can infect people. And so we do need to be worried and protecting our staff, ourselves that are working here. And then this is a business, right? Like many other things. And so we need to be worried when we have some of these concerns. This results in direct loss of revenue. For some of these organisms, like for instance, flu virus, we would actually have to shut down that facility for potentially multiple days. Those animals cannot even come back to the facility for potentially weeks. So that's a huge amount of lost revenue. And you can imagine the way things are, these talking about kind of what I like to call group settings. And so these are boarding facilities, daycare facilities, training, grooming, any of these types of facilities where we have multiple animals that generally come together for some period of time. And these are unique. And in some ways, they're unique because they're really fantastic. These are great ways for those of us that are going to travel, that we certainly have a place that we feel comfortable with where we can leave our animal. And then for doggy daycares or other types of similar facilities, places where our pets can get exercise, socialize with other animals when maybe we're not there. And so these afford a lot of fantastic benefits. They're also a little bit challenging in the fact that we have some diseases in some circumstances that can certainly become more of a problem. Why? Because we have, for one, high contact. So what do I mean by that? Well, we have a lot of contact between animals, people, and various objects. Those could be bowls, those could be rope toys, this could be whatever it is that's in that particular facility. And people and pets that are then going to have contact with each other. We have issues with indoor air quality. So all of these places have something in common, which is they are generally indoors. And so now we have a different kind of component to this. Do we need to be worried, concerned for the air that is going in and out of these animals in our own lungs? Absolutely. This is an important area. And then finally, we have a real variety of types of animals that come from different homes, that come with different, maybe even issues regarding, how old they are. Maybe they're young, maybe they're older, maybe they have other types of health problems that make them at greater risk for severe disease, and varied immunity. So for instance, are they all vaccinated with a certain core group of vaccines? Are only some of them vaccinated? Are they all up to date on vaccines? So all of these different pieces kind of come together and create this unique challenge in a way, and we have to be ready to rise to that challenge. And I suspect most people on the webinar are familiar with this, but just in case we're not, there are a lot of different ways that infections can spread. And I think, again, with COVID, I think we've certainly developed an appreciation for how some of those are. Certainly, there's the animal-to-animal contact. And we all know that. I think we hopefully take precautions to try and reduce those types of concerns when we're able to. But also, there are these concerns around contaminated objects. So for instance, these two dogs playing with this object, it's a shared object. They're getting the saliva on it. They're sharing saliva. And so certainly can be sharing other types of organisms, disease-causing organisms that are there. Simply breathing, coughing, sneezing are ways that they can share different diseases. Fleas and ticks and other parasites that are in the environment on them are ways to share. And of course, if they're allowed to share food and share water, those are other changes as well. What about the animals that might get sick? And certainly we know that that animals with signs of disease or illness are definitely a group that we need to be concerned about. But what about, there's also plenty of animals that might not show signs of disease. Either they haven't started to yet, or maybe they just won't, but yet they're still infectious, still able to pass that pathogen, that disease-causing organism. And so we need to be thinking not only about those with signs of disease, but also in general, about those even that look healthy. And for those of you that are saying, there's a couple of diseases, what's the big deal? And there's actually a lot of these diseases. The more you begin to look into this issue, you will see over 30 different diseases that commonly affect dogs and cats in North America, United States, Canada, that are common or can be common in these types of group animal settings that we need to be concerned about. That sounds like a lot, but the good news is this, is that if you have a common approach, we can actually address many of these with that exact same approach. Just as an example, so we've probably all heard of the term canine cough, or is sometimes referred to as kennel cough. And if this makes you kind of brings up your hackles in the back and makes you uncomfortable, it does me too. And part of why this is such a frustrating condition and why I dislike the name so much is because people use the name canine cough or kennel cough for one of these 9 different organisms that we have here, right? And so sure, it could be something like Bordetella, which can certainly cause this, but it can also be a host of different viruses and various other bacteria. And what's challenging is when we just use a simple term, people just assume it's all the same, and it's really not. It can become much more complex. And so it's important. You see some of these, we have viruses, we have bacteria. Some of these, we have very good vaccines. Some of these, we have vaccines that are good, but they're not quite as good. And that's just because they're challenging viruses to kind of make vaccines for. And some of these, we don't have any vaccines for. Right. And so, there might be different approaches to the way that we're going to potentially address some of these things, but recognizing that even something as simple as canine cough has over 9 different ways or different types of organisms that can potentially transmit it. And as an example of the complexity for some of these things, this is an outbreak of canine influenza virus in Ontario, Canada. And I want you to focus in on the middle. So this is a rescue. And so these are dogs that came into the rescue, and these dogs actually came in from Asia. And when they were imported in, these dogs looked pretty healthy, looked fine. Shortly after they got there, they started to actually have a little bit of a cough. And over the first little while, week or so while they were there, they had all these different types of interactions. And you can see the letters that are down there, right? So we see fostering and walking and boarding and going to a groomer. And so all of these different things led to households with canine influenza virus infections in their dogs. And the number after each, for instance, box and household indicates the number of dogs that they diagnosed canine influenza virus with. So in other words, from that simple couple of dogs that came into the rescue, this exploded so quickly in all these different households and in these very, very simple ways. Again, fostering, grooming, day boarding. So simple things that many of our own dogs, and are certainly obviously affecting potentially your businesses. So illustrates how quickly this virus, as an example, can move through a community and cause massive havoc. And when I say massive havoc, again, this is not a simple, well, we have a couple of sick dogs, we're going to just clean the facility, we're open tomorrow. Depending on the organism, so for instance, like canine flu, these places are generally closed for days, and they generally are not able to open up with those same animals to come back at least for several weeks. And depending on the organism, you have similar types of issues. So we have many sick dogs, so that automatically influences, for instance, all of these particular of your individuals that are going to be at your facility, moves very quickly from dog to dog, business closure, unable to readmit these animals. So can have a huge impact on you. Okay, so maybe some of you are looking at this picture and saying, yes, I can relate. That is sometimes the way I feel that I have to try and address a problem, right? There's lots of ways to address a problem. Hopefully, we all agree, let's choose a way that is going to be most efficient for ourselves and our staff, going to be most effective in terms of how it's going to work, and be most cost effective, right? So that's maybe the of infections, infectious diseases in our facilities in a coherent way, in an evidence-based way that we know is going to optimize how well it's going to work and going to get us the most bang for however much it's going to cost us in terms of personnel and resources and everything else. The answer, good thing, is yes, there is. All right, and these are generally called standards. And I'm going to introduce you to the IBPSA standards for infectious diseases, and very appreciative to all the people that were part of making these standards come together. So if you haven't heard of standards before, this is just a very general kind of summary of what they are. So it's kind of those behaviors, those actions that as a community we feel would be the accepted minimum. All right, so this is what everyone should do. Sometimes standards are attached to various things like regulations and other things, but it gives us that idea of this is at the minimum what we should shoot for. And so when we created these IBPSA infectious disease standards, we really wanted to try and figure out what are those criteria, what are those areas that we consider essential to meet the health needs for certainly the pets in your facility, in your practice, in your area, for the staff, for yourself, and also for clients, because clients are coming into your facility and in and out of your facility to some extent. All right, so that's what we're trying to do. That's the idea. Really important question. How do we develop these? How, and I was certainly one of the driving forces behind these. And so one thing is we really want to use peer-reviewed information. In other words, these are publications, and I've listed a couple of them on the side there, that have gone through a process by which other individuals outside of this group in the past have reviewed these, and they've been accepted into journals of prestigious journals for publication, and they've been published. So we know that they meet the minimum criteria to ensure that these are high quality studies or high quality articles. And then in the past, I've been working on this topic for probably over 10 years in terms of specifically related to infectious diseases in groups like group settings, like canine group settings like these. And so I certainly have been part of developing some of these types of guidelines as well as summary documents. And so the idea is, what are the practices that really can help reduce the introduction of these diseases into our facilities and help protect us from these diseases spreading? All right, and I will also say that there have been other individuals related to IBPSA who have reviewed these and have been part of that process. So this is really a very transparent process, so we can ensure that we come up with the most effective and appropriate ways to protect you and protect your businesses. So I'm going to kind of go through those. I would encourage everyone to take your time and to carefully read these standards. You know, the devil's in the details, and I'm going to try and kind of encompass these in a short period of time. But again, please do take the time to go through them. And there's a lot of details in there, and we really tried to really give you all the key information. But I'm going to kind of give at least a summary overview. So number one, as standards, things are only as good as how they are written and how they are conveyed to others. So these need to be written standard operating procedures, or SOPs, and those types of policies. So we're going to kind of go through what those mean. They should be included in every type of training program. So for all your staff, if you have volunteers, et cetera, so that everyone that enters your facility that works there understands what the requirements are. They should be specific for your facility, and that can be a little tricky. So that we do have a number of different guidelines, a number of different SOPs that are available that you can use as a starting point. But to make these most appropriate, they have to be tailored for your facility, for your risks in your facility, and various other pieces. So it's important you take the time to do that. Let's start with the animal housing standard. So number one, I think we all agree, let's keep sick animals out of our facility, right? Makes a lot of sense. How do we know, or how do we know if an animal is sick or infectious? A couple of ways. And so on the right-hand side, really nice screening checklist tool that we can use at our front desk to help us, remind us, you know, what are some simple questions we can ask our people that are kind of coming in with their pets, so that we can identify those animals that, one, are potentially sick, but also that we can identify that are most likely to be infectious. So number one, known or suspected to be infectious by a veterinarian. Great start, right? So if a veterinarian, this person has brought their animal to a vet for a particular reason, the veterinarian thinks that might be infectious, good reason not to have that animal in our facility. Number two, recent or international travel, and I'll talk about that one in a minute, but we do know that different diseases are more common in different parts of the world, and if we're not careful, we can introduce some of these diseases into our own facilities. As an example, in 2015, how do you think canine influenza virus got into the United States to begin with? Through dogs that were brought in through importation, so from another country, from Asia. And finally, if we do have a dog that becomes sick while it's at our facility, and this certainly happens, where do we keep it? How do we keep it in a safe way so that before the owner can come? And again, I've seen really, unfortunately, disasters occur where places just don't have a place to put that sick animal. They put it in the middle of where all the other animals are, and lo and behold, within hours, now all the animals are sick. And if they had a designated place to put that animal, they could have dramatically reduced the damage. So this is what I was alluding to. So we already talked about that little grouping on the left-hand side there, that rescue A. Where did those dogs come from? Well, they actually came from these dogs that were coming from parts of Asia, which had brought in there in part because of these rescue animals. And so rescue is becoming and has been a very important component of people and what we're doing to hopefully protect animals in other countries here and then bringing them in the United States. And that's overall a very good thing. The downside, of course, is with that animal, we bring infectious diseases. And so it's very, very important that if you have clients that are part of rescues, that we're very, very careful with the dogs that are being rescued. So we really don't want to bring those into our facility for at least a couple weeks, and maybe even think about not bringing in any dogs that are around those rescue dogs for this couple of weeks, because again, these dogs bring with them lots of new diseases that we do not want in our facilities, we do not want in North America. Okay, what about other types of housing standards? And so certainly a key component of keeping animals healthy is general preventative care. I think we all know that. Hopefully we all practice that with ourselves and our families. The same thing is absolutely true with the animals that we have for ourselves or the animals that are coming into our facility. And so we want to make sure that there's a minimum standard of what's required. That includes required vaccinations before those animals come in. That includes deworming that these animals are getting and frequently getting throughout their lives, as well as flea and tick prevention depending on where you are located, and ensuring that that happens before they start. Most of us are truly pretty good at that. It's the follow-up. It's ensuring that we actually have a good feel that these animals are maintained on that throughout their time at your facility. So, 6 months down the road, are they still on the required type of preventative care that they should be? And I'm going to dive into a couple areas here. Let's start by talking about vaccination. Definitely a really important component of any health group, whether it's human health, whether it's animal health, etc. And so part of this is really identifying what that minimum standard is, that minimum number of or types of vaccinations that are required. And secondarily, ensuring that there's a way that you can be confident that the animals coming in have truly met that standard or met that minimum requirement. That means being verified by your staff, looking at vaccine records, looking at letters from veterinarians, whatever that minimum standard is. This is, again, before the first visit and then periodically, because as we know, vaccines do need to be given throughout life. And so we want to make sure that those animals stay up to date. That includes series, so the first series, boosters, etc. Another part which oftentimes we see facilities sometimes don't do quite as well on is making sure not only have they received the vaccine, but as we know from ourselves, true for anything, is that these vaccines, they don't work immediately. This relies on the immune system to work, right? And so some of these vaccines may meet that kind of beginning top immunity a week out, some vaccines it's 3 weeks out. And again, in the standards, we kind of walk through all the different scenarios and different types of vaccines and how long you want to wait. But it's very, very important that dogs that are coming in, if you expect that dog is going to be vaccinated, it's not just the vaccine, it's actually the immunity that you want, right? So making sure that dog has received a vaccine at some point in time before they come in. I've highlighted a couple of these handouts, and I'll show you this on the side here on the left-hand side. A number of really, really nice handouts that I've included in the presentation, and these are all available to you guys, and you can use them as posters. You can use them however you want, and as ways to kind of educate yourself and educate your staff. From one of those posters comes this little cutout, which again, what are we trying to do? What are the key vaccines that we want? How often do they need to be given? And again, there's very specific information about types of vaccines, when they're given, how long, what that interval is, how often they need to be given. Some of these vaccines need to be given every year. So leptospirosis, canine influenza virus, bordetella, these are annual vaccines. And so we want to be able to have a way to ensure that they're meeting that. And ensuring that if they're just starting that series, that they've received all the boosters that are required, all the different components or doses during that initial period. And the same thing, of course, is true with cat vaccines. So we've talked about vaccines. Let's talk a little bit about, so vaccines are great, they're really important. We don't have a vaccine for everything, right? Wouldn't it be great if we did? Maybe someday we will. We're on our way, but we have lots of other different types of organisms that we address and we're concerned about when it comes to infectious diseases. And part of the way that we really need to be thinking about them is in environmental cleaning and disinfection. And we know that All of these organisms can live in the environments for some period of time. It might be hours. In some cases, it might be years. And so if we don't effectively clean and disinfect after an animal, then that organism lives in the environment and then can potentially spread to people, spread to other animals. We can bring it home with us to our own pets. Not good things, right? And so simple things, even a couple of days, canine influenza virus. I've seen situations where people have gone on in, they've seen a dog with canine influenza virus, haven't thought too much about it. They had some gloves on, etc. Walked out, took out the gloves, went back and looked at a couple of other animals that were back there. Didn't know it, but they actually had canine influenza virus on their own jackets, on their shirts, transmitted the virus over to another animal. So can live in the environment, can even live on our clothing. So how do we address this? Cleaning and disinfection is the key way that we address these surfaces. All right, so we want to make sure that we have standards in our facilities that address this key group. So all indoor areas and all outdoor areas. I'm not talking about cleaning and disinfecting grass. You're not going to get very far, or dirt. But if we have areas that, for instance, our animals are going to be spending time on, and we know that we want to try and clean and disinfect those areas, then we need to make sure that we have a substrate, cement, or something else, if that's going to be a key area, that we can clean and disinfect. So we want to say, how do you actually perform it? So how should our staff do it? How frequently should they do it? These are all part of the standard operating procedures. What product are they going to use to disinfect? What concentration of that product do they use? What's the contact time? So how long does that disinfectant actually need to stay wet to kill the organisms that we're worried about? And then finally, these are chemicals, and some of them are very safe and some of them are less safe. But regardless, we always want to make sure that we have policies so that we can ensure that these are all used safely for our staff and we store them safely. We're going to go and we're going to kind of get into some more details here. Before I do, though, I don't know, again, in the era of COVID, I've watched a lot of Netflix the last number of months. One of my favorites is Nailed It. And so if you were to ask somebody, did you make cupcakes? And they said, yeah, I made cupcakes. And you can say, all right, I think I can envision what that cupcake looks like. And then you actually get to see the cupcake, right? And so the left-hand side are the cupcakes that we're supposed to make. And then the middle is the cupcakes that people made. I think we'd all agree they're not the same, right? They may taste all right, but they're certainly not the same. The same thing is true with everything that we do with infection control, with preventing infections in our facilities, and cleaning and disinfection is a perfect example, which is if you ask someone to clean and disinfect, they can say, absolutely, I did that. You actually go into actually how they did it, and there may be the difference between the really, really nice cupcake and the one which probably isn't quite as good and a lot of errors in it, which may lead, unfortunately, hopefully not with the cupcake, but to infectious diseases. So let's talk about that. So what are the key elements that we need to be thinking about when we're cleaning and disinfecting? Number one, we clean and we disinfect, all right? So we want to make sure that a surface has been cleaned adequately before we try and disinfect. Disinfectants vary in terms of how well they work in terms of organic material that's there. So hair, it could be even dirt, it could even be feces. So some of them work better than others, but none of them are perfect in the face of organic material. So we need to try and get rid of that. Then we need to apply our disinfectant. And again, thinking about those three key issues. What product are we going to use? What chemical? What dilution? And how long does it need to stay on there? And that needs to be really, really clear to our staff members. And we need to be telling them when, right? So certainly some key concepts, definitely between animals, right? So if we're going to be using the same kennel, I think we all agree that we're now going to clean and disinfect that kennel before another dog comes in or another cage before that cat goes in. Potentially multiple times if the animal's there for a number of days. So periodically over the period of time, over the week, we're cleaning and disinfecting, just doing a little spot cleaning after they've peed or pooped or whatever it is. And then multi-use surfaces. And again, this is where we can see disasters happen if we're not careful. So grooming tables and equipment, crates, runs, anything that's got that common surfaces where animals share. Sometimes this is really tough, right? So we have doggy play groups, and so we're not going to be able to disinfect between every single dog, but certainly we potentially can do it between different groups that come out. So thinking about ways that we can address this becomes extremely important when we're trying to reduce disease transmission. So I think the concept of what disinfectant to use, that is a really, really hard area for a lot of us. And unless you've gotten training in this area, it is going to be hard. Good news is this. There are a number of really good resources that are available that can help you to identify how we go through this and what we do. And so let me give you some examples here. And so on this table, and again, you can see here where it's linked with the biosecurity URL at the bottom there, and a lot of these different products are going to be available to you, freely available. And this particular one, on the far left-hand side, you can see the different types of organisms that can cause disease in ourselves or in our pets. And then across the top, we see the different types of disinfectant groups that are out there. The far right-hand side includes things what we call quaternary ammonias or quats. You can see in there, again, the accelerated hydrogen peroxides like Rescue. You can see bleach and various other groups. And so you can see there's pluses and minuses, and this may not be large enough for you to read, but again, this is available freely to anyone who wants to see and take a look at it. But the key concept is we want to choose disinfectants that are going to be able to kill the things and the items that we want. And if you're able to see, there's one particular area in there which talks about non-enveloped viruses. And that's kind of where we see things really fall apart, where in other words, some of those disinfectants aren't going to do very well and others of them will. And so that's one that we really want to be thinking about in terms of things like panleukopenia in cats, things like parvovirus in dogs. And so there's only a couple of different disinfectants that are going to be effective in those realms. So it's important as someone who is operating a facility to ask these key questions of people that are selling your disinfectants so you know what you're getting. Finally, you want to be able to pull it into a standard operating procedure. So Virox has done a really nice job of creating this standard operating procedure SOP development tool. You don't have to use Virox's product to be able to use it, and I would encourage everyone to kind of take a look at it because it actually helps you to identify within your facility what are some areas that we want to think about, how do we want to do that, how do we want to articulate or present that to our staff. So I think it's a really, really helpful tool regardless if you use their product or not. All right, so let's talk about air quality. And I hope when I talk about this that everybody is thinking about COVID, because this has gotten a lot of attention. This is an area that I think oftentimes gets missed, whether we're talking about human health or we're talking about animal health. But COVID has really brought this concept to the forefront of health. And so you see this, for instance, kid with a mask on. And I think, you know, if we had seen this a year ago, we would have all said, why would a child be wearing a mask? Now, this is commonplace. And in fact, many of us would be just mortified if we saw a child outside without a mask on. This concept that we are breathing in particles, droplets, aerosols that come in and can be infectious. We can expel these same droplets or aerosols to others and transmit diseases that way. Has gained a lot of attention in terms of obviously COVID, but by extension, many other diseases that we need to be addressing, whether it's for human health or whether we're talking about animal health. Again, a cutout from one of those particular posters. Documents, so droplets, these larger items generally don't go very far. We talk about that 6 feet, 2 meter distance that most of these travel and then drop. However, in some circumstances, depending on the organism, depending on the indoor air quality, depending on air currents within that facility, et cetera, we can certainly have items that can go much, much farther. They can get aerosolized themselves and get transmitted in much farther than that 2 meter or 6 foot distance. So really need to be thinking about the surfaces that are going there, but also the way that we think about the way that our air is addressed from an air hygiene and air cleaning and disinfection standpoint. What does that mean? The good news is this: some of these things are relatively simple. So if you see these pictures and this looks familiar to you in your facility, the good news is it's a pretty easy thing to start addressing, which is this: air exchanges need to be clear of all blockages. So that lower left-hand corner, there's no question there is some massive problem here, right? Hair, dirt, who knows what else is in there, disrupting the ability for clear airflow to go. Pieces of that are getting into the air system and are being pushed out into other rooms. Not a good thing. You can see the upper right-hand corner, that is actually a filter. It should not look gray like that and dirty. Someone hasn't been changing their filter. You can see on the lower right-hand corner here, mold or something else that certainly looks like mold on the surface in this around this air duct. So a lot of things that are pretty easy to do. So we need to have a plan for cleaning these air exchanges. We need to replace UV lamps. So if you have a UVGI, these are the ultraviolet germicidal radiation systems. UVGI. systems. These are important, can be very, very helpful, and I'll show you a couple slides coming up, but you want to make sure that you are changing out those UV lamps periodically. Yearly is generally what's recommended, and certainly any filters as is indicated. If you are using filters, which pretty much we should be, you want to make sure that you are using the at least minimum standard filter to trap those disease-causing organisms, because we want to trap those in the filter. We don't want them traveling through the facility. So let me give you an example of what this might look like. And I think because we all have a hard time maybe visualizing. So this comes from one of the sources. So we have air disinfection, and this comes from an animal center where they actually were testing the air. So they, in this particular location, before they put in these UVGI units, before these radiation units went in, they took a little Petri dish and they put it near the air vent, had it out only for an hour, closed it up, and then let that sit for 3 days. They did the exact same thing after they installed these UVGI units on the right-hand side. Now, each of these big black dots are either mold or bacteria that are growing, and certainly we can see on the left-hand side, before the UVGI units, we have a lot of different things that are in the air, and then on the right-hand side, very, very few, if any. All right, and again, 1 hour of exposure to the air. What does this mean for you? And that's always my question, right? So that's all, worrisome, whatever. But what does this mean for the animals in your facility? And prior to this particular paper here, there was very little out there around this area in veterinary medicine, in animal health. There's definitely stuff that's out there in human health, but this is one of the first papers, and they've done a really nice job of actually capturing that, which is this. They had a kitten nursery, and they had 2 time periods. One period when they didn't use these UVGIs, these ultraviolet germicidal irradiation units, and then another time when they did. And they actually watched the kittens for upper respiratory tract infections. Before putting in the units, they had around 12% of the cats over this period of time that developed upper respiratory infections. After they installed the units, just over 1%. That's over an 87% decrease. That's pretty impressive, all right? So actually, it's more than impressive. It's incredibly impressive. So just demonstrating what this can look like in terms of infectious diseases and the ability for these different types of approaches to work. And so if you are using equipment, again, thinking about this 99.9% kill of these key disease-causing organisms. And so a couple of key concepts that are in there in terms of you don't want it to produce ozone, you don't want it obviously to re-aerosolize the organisms or basically continue to push them back out. So the concept of UVGI. Most importantly, this is a complex area, and it's really important that you speak to somebody who understands the system, can come and give you an assessment of your own system, and you can go for there and determine what's most appropriate for you. All right, so we've talked about vaccines, we've talked about cleaning and disinfection and in surfaces, we've talked about our air quality. Let's talk about a couple of other things. And then again, hopefully this resonates from COVID. Hygiene, or in other words, cleaning of our hands, can be extremely important. I often talk about these as the 10 most dangerous things that we all carry, right? Because we touch everything. We're touching pets, we're moving from pet to pet, we're touching objects, we're touching our food. How do we protect ourselves? How do we stop moving different organisms to other animals? And that's very simple. It's cleaning, it's basically washing our hands with soap and water or using alcohol-based hand sanitizer. When we enter the facility, when we exit the facility, and certainly between animal contexts when we can. That sometimes that's just not possible to do it, for instance, in a doggy daycare setting, but with every dog, but certainly between groups of animals, definitely periodically throughout that, definitely before we're eating, before we're drinking. So some clear ways that we can do that. And hopefully right now, if you guys are operating, that you're already doing a really, really good job at this, and this is just something to continue forward with. Clothing. I've already talked a little bit about getting viruses, getting bacteria on our clothing, bringing that to other animals in the facility, bringing that home. We don't want this to happen. So really having dedicated clothing for people that are working in your facility, ensuring they change into that clothing when they get to the facility, they change out of that clothing before they go home. Machine wash on hot, machine dry on hot. That's generally adequate to kill the basic stuff that we're going to be seeing. If you have an animal that's diagnosed with something that is more concerning, you can certainly reach out to someone, reach out to me, and I can give you some advice on what to do in those particular circumstances. But generally, this works absolutely fine, but we have to do it. Food and water, right? Again, what goes into our animals? Certainly, if there's disease-causing organisms in there, we can easily transmit this across. So having a way to ensure safe water, safe food. So not sharing food and water if unless they're housed together. Storing food in a safe way to ensure that if it's recalled, we can pull it. We're not serving uncooked meat and uncooked eggs in our facilities. This has been linked to salmonella transmission in animals, has been linked to salmonella infection in people. So please be cautious, don't do it. What about housing and play? So again, we know a lot of these things, I think, in the backs of our minds. It's just enforcing them. The more animals you put in your facility, the greater the push is on infectious disease spread. And so we need to think about really what's that maximum capacity that really our facility can withstand safely, and doing everything we can to spread animals out and to make sure that we continue to keep animals in safe ways. And so how do we do that? So max numbers, as I've talked about. Play groups can work really, really well. So we have certain groups, or we call them cohorts. They function and work together, they play together, and then that's the same group that we try and keep them together, so that if one of them gets sick, it only gets that cohort sick and it doesn't spread to all the animals in the facility. And if we keep those cohorts the same every day, or at least as we're able to, can make a huge impact on reducing infectious diseases. How do we minimize unnecessary animal-animal contact? So just like that, or not letting animals touch each other, etc., all key ways. And as we get to the end of these, having a way to respond to infectious disease problems. In other words, in our records, we need to make sure that we've got the date that the animal was there. We need to know the location, ideally, if we can, of where that animal was kept. And we need to know if there have been any disease concerns, either reported by the owner at some point, whether we saw them when they were sick. And I just show on the right-hand side here, this is an outbreak of parainfluenza that we had at a veterinary facility. And so parainfluenza, one of the causes of canine cough, and it started very simply with two dogs. One dog was walking through a run area and had nose-to-nose contact with another dog. And then from that, and within this particular area, we had an outbreak of parainfluenza because this one particular dog was acting normally, but was shedding the virus. That's a problem. And so we had these 5 dogs that got identified from the outbreak. And why I raise this is that once we knew that one dog and we knew what had happened, we were able to identify all the other dogs that were in that particular ward, in that particular enclosure area, and we're able to stop those dogs from having contact with other dogs in our facility, and we stopped the outbreak. So it stopped at 5. All right, and that was impressive because what that could have been was an outbreak that went through the entire veterinary facility. So responding quick can be huge. So as I wrap this up, a couple of key things. The benchmark of what we think is acceptable is constantly increasing. And so we need to be rising to that occasion. So please use these IBPSA infectious disease standards to help you reevaluate your standard operating procedures and help those guide you to make these even better to protect pets and staff. A number of resources that I've identified through this that are out there, all of these are free, all of these are available to you. And finally, with that, I'm going to allow others to come back on and take us into the question and answer period.
Well, thank you, Dr. Stull, for an amazing presentation. And we'll just give all of our panelists a few seconds here to turn on their cameras and microphones again. Here we are. Perfect. So welcome to our panelists. Thank you for joining us for the Q&A portion. So we have Dr. Karen Stasiak from Zoetis, Annette Uda from Pet Therapy, and Carmen Rustenbeck from IBPSA. And a great way to start off these questions would actually be with you, Carmen, because we referenced the standards. And one of the questions was, what further training will IBPSA be providing around these standards?
So IBPSA will be reaching out, but first of all, let me say thank you for having me on. And Dr. Stull, you did a fantastic job. Thank you for your presentation. We will be putting more in the member area for IBPSA members to watch videos on different cleaning solutions that are out there, how to make sure that the protocols are established correctly. We'll be doing a lot of referring to our professionals that are on today's call, for their resources that they've also put out there. So we're looking at those AHA resources. We'll be also looking at the resources that Virox has put out, because there's no reason to recreate the wheel. So we're going to use the community and bring those resources in-house for us to provide further education as needed, and just keep it there as a library resource for people to go back and look at.
Yes, and we will be sharing those resources that were referenced in a follow-up email today. And speaking of referring, one of our audience members was asking if there's a reference or contact available to talk about UVGI, as they're currently doing the mechanicals for their new building and want to put in UVGI. So Annette, perhaps you could take that one.
Sure. Well, I love hearing the word mechanicals. As Dr. Stull had mentioned earlier, it's really critical in order to achieve those high kill rates and to get viral load down and disease mitigation. We really need to get the mechanical drawings, and even floor plans would be fantastic. We do all of the sizing for free, but yeah, if you could send us your mechanical drawings and floor plans to Annette@pettherapy.com, then that would be great. We could forward that on to our engineer, and we can get sizing and information back to you pretty much same or next day.
And Annette, while we have you here, could you explain how does UV light replace surface disinfection?
No, UV actually can only kill what it can reach, right? And so Dr. Stull did a great job talking about how it's critical. You have to clean and remove debris, and then you've got to disinfect, wait for the contact time. So UV can be used in water filtration plants, surfaces, and air. But in order for UV to work, it has to penetrate. So for instance, you have to clean, right? You've got to get rid of the debris and the hair and everything else. Once you do that, you want to put a disinfectant down, because that's going to give you your high kill rates and the amount of time you need. To me, UV for surface disinfection is really, I call it my insurance policy, meaning that if there's anything that might microscopically be left behind, then it's great to come back with that. But it never will ever replace surface disinfection. So please keep cleaning.
Well, on the topic of contagious infectious diseases, this is a great question for Dr. Stasiak. How contagious is canine flu, and do the vaccines work better than the human flu vaccines?
I love that question. I spent 20 years in human medicine, so dealing with humans and human flu and people not wanting to get their flu vaccines. We've seen CIV outbreaks all across the country. It's highly contagious. We've had dogs across a fence line with people rescuing dogs that were brought in through, through California and up to the Pacific Northwest. We're just across a fence line, so you don't know your neighbors are rescuing dogs that were over in China. Your dog's in the backyard minding its own business get flu. We've had dogs get flu from service elevators, not even around another dog. And really, you put a dog with flu in a run next to a dog that doesn't have it, within 36 hours, we've seen the disease manifest itself in that exposed dog. So it's very contagious. And, we don't have herd immunity in our dogs for dog flu. The good news is, unlike the human flu vaccine, the dog flu vaccine is very efficacious. We've had human flu around for 100 years. It's been able to change steadily over time. Dog flu is fairly young disease. It's 20 years at the most around, both here over in Asia. So at that point, we know the vaccine's really efficacious. So we need to get it out of our dog population. We don't want to be, 100 years from now talking about how poorly efficacious it is, like the human flu vaccine.
Well, while we're on that topic, a great follow-up actually came in from a facility who has a community water bucket for their daycare participants. How would you suggest minimizing the sharing of water buckets between pets, yet still allow access to fresh water? And Dr. Stull, this probably could be a good one for you as well.
Yeah, sure.
I love that question. As I go and see in these cities, these big petri dishes, I call them, the dogs drinking out of, they do really high risk things, right? But I'll be curious what Dr. Stull says about that.
Yeah, no, and it's come up, and it's always a hard thing. The same thing's true for whether it's a communal bucket or whether it's a wading pool for dogs to kind of cool off on. we do need to be very, very cautious about those, especially with the smaller water buckets. These are places where you've seen, dogs drink from these. This is not, an aseptic or a clean way. There's all kinds of stuff coming in, going out. So anything that's in their mouth is now in the bowl. And those organisms can live quite well in that water for a short period of time and be a really effective way to transmit diseases across groups of dogs. So how do you get around this? So there's a couple ways. One is obviously if these dogs happen to be boarding or they have their own areas that they're going to be segregated, that's where they get their water. That's not always going to be happening with all of these types of experiences. So another way that I really, really like are little fountains where the water doesn't pool. So it's a fountain where the water comes out. It's kind of like a faucet, right? Like a drinking faucet for dogs, where the water comes out, it sprays on the ground. There's ideally a drain or some type of gravel adjacent to it, so the water doesn't pool. Dogs can cool off, they can get hydrated, they can get all those benefits that we want, and they don't have the negative side effects.
And Dr. Stasiak, anything to add to that?
Yeah, that sounds perfect to me.
Well, we are on the topic of water because we had another question come in from Carmen, who says that Carmen would like to use their outdoor water faucet for water when the dogs are outdoors. However, they've learned that the faucets are considered non-potable. Apparently they have lead. So how safe is this for dogs on a short-term basis? They're saying they can change out the faucets for more expensive faucets if necessary, or is there a filter that could be added to remove the lead? Any ideas would be welcome here.
I can start this unless anyone wants to jump in. So look, it's really a funny thing, right? So we think of animals as being, oh, but it's a dog. It must have some kind of amazing ability to fight diseases. If it's not safe for people, chances are it's probably not really safe for our animals either, and certainly not ones that you're taking care of. And so the specifics around that, you might have to get somebody who can evaluate your water system, find out if there are ways to reduce the lead that are in there, what the levels are, and whether those are going to be a concern. Things like E. coli, things of all the different types of, kind of systematic or the ways that we approach drinking water in our own homes are certainly a good idea of approaching those where what would be feeding to the pets and animals that are in our facility. So it's going to depend a little bit on the specifics, and I would encourage you to kind of reach out to some folks in the area and see if they can help you out.
Yeah, I think that's great advice. And our next question pertains more to surface disinfection. There's a question that came in from Carmela who would ask, how do you handle dogs who eat raw? So this would be specifically referring to when you mentioned not having raw meats in the facility.
Yeah, and so, we can debate the pros and cons of raw, and we don't have time for all that. What I can tell you is this. From the evidence, there are very few, if any, true pros, so not necessarily enough to outweigh the very clear cons, especially at a facility. So if a family chooses to feed raw, and many of you on this call may do that yourselves, totally fine. Just do it carefully. Be aware that these are organisms that cause foodborne disease outbreaks in people and animals. So salmonella, listeria, various types of E. coli, these are reported all the time. And that makes sense. We have, uncooked meat, we have uncooked eggs. So you have people in the household that are immunocompromised, young, elderly, pregnant. We need to be very, very cautious. But if you're going to do that at home, go ahead and do so. Just be careful. In a facility like what you have, whether in one of these dog group or cat group events or facilities, we need to be extraordinarily careful, because the last thing we want is to have someone who works for us get ill, pass it along to another pet, and animals can get very, very sick with some of these organisms. So I would discourage you from allowing the feeding. I understand that might come with some pushback. If you do decide that you are going to allow it, you need to be just as careful as if you're handling raw chicken, raw eggs, as you would be in your own kitchen. So if you're handling it, you have a special part in the refrigerator where it's kept. There's a bowl underneath it, et cetera, so it can't leak out. People that are feeding it to the animal, it's fed in a very clear, specific area. It's not allowed, people are ideally washing their hands after they've been around it. And then cleaning and disinfection is key. So you're definitely going to want a disinfectant. So first of all, clean like we talked about, but use a disinfectant that that is going to work very, very well in some of these types of organisms. And so something like an accelerated hydrogen peroxide would be my first choice in general with these general kinds of organisms. So that's the recommendation. If you do it very, very carefully, and most importantly, have a very clear written standard operating procedure for how you do this, and what your expectations are of the owner when they bring in their food.
I think it's great advice. And let's circle back to Annette for a minute. And Annette, could you explain the difference between UV for HVAC and upper air or upper room UV?
So again, so UV there's different I guess products out there, you will, or if they're different applications. So upper air UV is going to be helping to reduce viral loads within a room immediately. HVAC is going to be as the air is circulating through the building. So to give you an idea, so as Dr. Stull had showed the pictures, when you have a ventilation in your room, you have your return vents and your supply vents. As the air is being sucked in, generally engineers, when the building's being built, will pretty much estimate it, unless it's a hospital setting, to be 6 to 8 air exchanges per hour. But what happens if you have a high viral load with animals or sick people in a room and you don't have time to wait for those 6 exchanges per hour? You have a limited time. So the upper air unit will actually help to draw the pathogens up, kill them on contact, to reduce viral load. The less viral load you have, the less transmission of diseases is most likely going to happen. So it's kind of a 1-2 thing. So I would think that the HVAC UV is very important to have. I would not skip that process, but if you have higher risk environments like your lobbies, isolation rooms, things like that, where animals are congregating, playrooms, then you definitely want to bring in an upper air to get that extra cushion for viral load reduction immediately.
Okay, great. And follow up, how is UV different from using an ionizer to clean the air?
So I always go on record saying that there's great technology out there. It just depends on what are you trying to accomplish, right? So an ionizer uses positive and negative ions to go out into an atmosphere, collectively trap dust particles. It'll start becoming heavier and drop the particles out of the air, which the particles may contain bacteria, viruses, mold spores, things like that. The problem is that when they're dropped from the air, that doesn't mean that they're dead and they're killed. So if you're walking by cleaning, a dog's wagging or anything else, you can actually re-aerosolize those pathogens. So for us with UVGI, our whole goal since 2008 is how quickly can we kill those pathogens on contact. We just did a study that came out showing that within 1 air pass, that we were able to kill the pathogens at a 99.97% kill rate in 1 air pass, meaning that as those pathogens are going in the room, they don't have a potential of re-aerosolizing because they're no longer infective. So again, it's a matter of instant kill versus a long period of time.
Yeah, that's amazing. And our next question is actually really more for Dr. Stasiak. Is it safe to give an intranasal or oral Bordetella vaccine less than a week before boarding? Are they contagious and should they be separated?
That question comes up frequently. When we're thinking about a dog that's current on vaccines and they just happen to get their booster of that modified live vaccine, they're current, they should be protected from Bordetella. They go into the facility, they'll be shedding the vaccine organism, but that's not going to cause disease to the other dogs. They're sort of like just sharing little doses of the vaccine. But if you have a dog that's never been vaccinated or they're late, they're lapsed, and it's less than 7 days and they've had the vaccine, they're not protected. And they could very well be incubating the disease. And we know with these respiratory pathogens, they're shedding lots of, whether it's bacteria or virus, before they're showing clinical signs. So that dog that's not current, that happens to be short-term vaccinated, that dog should be separated from the others. I wouldn't allow them in the group playtime, and ideally in a separate area so they're not perhaps incubating an illness and going to cause disease. But if it's just vaccine and they're current, that's safe.
And we are just about out of time here today, but this information is also well summed up in the standards. So Carmen, how often are the standards going to be updated?
We will update the standards as we find need, whether we have a new virus that we're dealing with or we have a new protocol that we feel that would increase the cleanliness of a facility. And that all has to do with what this group of people that are today on the webinar, what they see coming down the pipe, as it were. So like just when we dealt with dog influenza and we had a new one and it was just it was just wiping out facilities. We immediately reached out to say, how do we change protocol? What do we have to do to make sure that facilities are safe? So we'll be often looking for that. Also, if a member has a specific interest that they bring to us and we realize that they've asked a question that requires us to update standards, we will update those and make them immediately available to the membership. So it's a living document, always living, always looking to be adjusted and made better and more useful and helpful to facility owners.
Well, that's great. And that is all the time we have for today. So thank you so much to you, Dr. Stull, for such a great presentation. And thank you to our panelists for joining us today. And thank you to all of you who tuned in. If you have any further questions, please visit rescuedisinfectants.com. And you will also receive a follow-up email with a link to the recording of today's webinar, as well as the additional resources that were referenced. So on behalf of Virox Animal Health and our presenters, thank you for joining us today.